Hi, I'm Dr. Becky Coates with TMJ Plus Wellness. This video series is going to show you how to take care after a tongue or lip tie release. So this is a week later after the sutures are removed. We're going to use our wonderful patient model here, Jade. She's going to help show and demonstrate. So after the sutures have been removed in office, whether it's lip or tongue tie, these are the exercises to focus on. So the first one is going to be able to move your lips around. So you would use your thumbs and the vestibule of your lip to be able to move in motion. The lip ties would be on the sides and probably in the midline. So you want to get your lips in motion, just moving all around. Same thing would be for the lower lip ties. You want to use your thumbs, move the vestibule around. The reason why that's important is because reattachment is occurring over the next 2 months, even if it looks good on the surface. How many times a day do you do that and how long? That's probably like a minute or two of exercises, and you want to do those every 4 to 6 hours in the day, okay? The other one is the midline ties. Right underneath the nose, they might feel kind of bumpy where the sutures come together. So you'd want to use your thumb and lightly do a C shape forward. That might be tender under your nose, but again, we're doing this because of reattachment. Same thing on the lower with clean hands, moving up through that, because it'll feel like in the appointment I'll say, oh, it's like when cookie dough is like kind of bumpy and you want to have it smooth. You want to be able to work on that. Also, you can work from the outside on the skin side, and you can lightly massage on the chin fold area or underneath your nose to lightly rub that. So that was for the lip tie areas. The other thing that we've noticed is really good is from a surgical standpoint is to do what's called tongue pulls. Tongue pulls may not be something that your myofunctional therapist will review with you, but from a surgical standpoint, you want to hold with a Kleenex or gauze and just pull straight and hold for a good 30 seconds, okay? You're going to feel probably resistance and tension at the base of your tongue. It's not the frenum, but it's the base of the tongue or through here. So sometimes patients will say, oh, this part feels tender or back through here. So the tongue pulls are important. They're straight out for 30 seconds. And then you also go left lateral 30 seconds and hold to resistance, and right lateral and hold to resistance. Almost like if you were touching your toes and you're like, oh, it kind of hurts to do that, but you got to keep pushing for it, that kind of thing. So tongue pulls are important there. The other thing that we notice is that the myofunctional therapists that you're seeing, they are keys to success. So you have to maintain that relationship, not pre, but also post-therapy, as you have to see your myofunctional therapist, listen to how many appointments and sessions that you need to go for your individualized needs. Not everyone is the same in their needs, so don't compare against another patient. Everybody's different in posture and what their grade of restriction was. But they will give you other motion of the tongue exercises that you need to follow. But the ones I would also add to that would be what's called your cave hold or suction hold. There's different names for that. So after the sutures are removed, this is not when the sutures are removed, you want to start working on your prep work that you would have done, okay? Then you would have done those lightly, and you would have done again like every 4 to 6 hours. You would also do one that's called the peanut butter roll. Like, I'm sure you've heard of that. If you had peanut butter stuck in your palate, you would just gently roll your tongue back, okay? And the other one is called click pops, and some therapists call them push-ups. So just basically tongue in motion, because you want to work on the healing aspect. Again, your myofunctional therapist may do slightly different versions of these and guide you, but these are just examples of the tongue in motion that you might hear. Okay, now if we give you a toothbrush at your post-op appointment after sutures are removed, this is to lightly help where the suture areas will be healing, maybe slightly tender, but just to massage. And when you brush your teeth, like 2 times a day or 3 times a day, you just want to lightly go in motion up on the tongue. That way, if there's any little tender spots or maybe tiny little white spots where the sutures are, you're just massaging that tissue there. And that's a special brush. It has very soft fibers there. Very important, the osteopath that you worked with, your provider is going to say, I want to see you after the tongue release, a week, maybe a month later, and they will guide you on the interval. The reason why that's important is because most people have tension in the neck, and their shoulders, and the osteopath is still guiding because you've released fascia throughout your body, and you need to continue that relationship. If you have any questions, you're more than welcome to text or call our office. I'm Dr. Becky Coates with TMJ Plus.